In the morning. Hello and welcome everyone. It's Ms. Sandra Bidari, accredited social worker pursuing graduate certificate in mental health practice at Victoria University. Before we begin, I would like to acknowledge the traditional custodian of the land on which we gather today. I pay my respect to their elder past, present and emerging, and I extend that respect to all the Aboriginal and Torres Strait Islander people here today. Thank you for your ongoing connection to the land, culture, and the community. In today's video, I'll provide a case study of Sarah. Sarah's story highlights the complexity of mental health, particularly among Indigenous Australians who is diagnosed with general anxiety disorder. Sarah presented with symptoms of social phobia and depression. She included evidence of crowded space, withdrawal and reverse sleep cycle. Her recovery involved the brief intervention in youth mental health toolkit employing motivational interviewing and narrative therapy. This presentation discusses her case within the broader context of the mental health in Australia, the intervention used, and the importance of culturally sensitive care. Mental health is essential for overall well-being, helping us manage anxiety and actively engage in our community. In Australia, around 20% of people experience mental health issue annually, with the depression being particularly prevalent among the young people. In Sarah's case, her mental health challenges included persistent sadness, a lack of interest in activities that she find enjoyable before, and social withdrawal. Her dual diagnosis of depression and social phobia illustrate the interconnected nature of mental health condition, emphasizing the importance of tailored holistic care that addresses both individual challenges and their strengths. Depression in today's days, like we often ask to someone, they said, "Oh, I'm feeling depressed," but it's more into that. Depression is no longer seen as just sadness or personal weakness. Today it's recognized as a severe mental health condition that impacts thought, emotion, and daily life function capacity. Depression arises from a complex interaction between biological, psychological, social, and environmental factors. For young people like Sarah, this can disrupt development, her development, education, and social well-being. Indigenous Australians face additional challenges, including historical trauma and limited access to the culturally appropriate services. Addressing this broader factor is essential for effective intervention. Sera care involve a mix of pharmacological and non-pharmacological intervention. Pharmacological intervention is the intervention that use the medication such as antidepressant to correct uh, neurochemical imbalances. While effective in reducing symptoms, they require careful monitoring for the side effect. Non-pharmacological intervention, this focus on psychological and behavioral strategies such as cognitive behavioral therapy, narrative therapy, brief intervention in youth mental health toolkit, acceptance commitment therapy that prioritize like improving sleeping hygiene, practicing mindfulness, and engaging in the mindfulness exercise. Yamai empowered Sarah to take an active role in her recovery process, while narrative therapy helped her explore her experiences and connect with the cultural identity, fostering resilience. Assessment is a foundation of effective mental health care. It involves a structure and the continuous process to understand an individual's strength, challenge, and context. For Sarah, we used a biopsychosocial assessment or the model which considered the interaction of the biological, psychological, and social factor. Tools like Hertz framework provided insight to Sarah's home environment, her education and employment, her relationship, mental health, suicidality, sexuality, and we also conducted the indirect assessment called MSc, mental state examination, which evaluated Sarah's appearance, behavior, mood, and thought process. Risk assessment identified potential dangers such as self-harm, suicidal ideation, or social isolation. Um, by saying that, we also use the standardized measures tools like K10, Oasis, and Cures to assess and track Sarah progresses. Like mentioned earlier, those assessments help to gather critical information about our home environment, substance use, and potential suicidality, facilitating rapid building and deeper understanding of our challenges. The Ketan scale measured our psychological distress. Oasis scale assessed how anxiety has been impacting on her daily functioning capacity or her daily life. Kurz evaluated her depressive symptoms, and these all are the direct and indirect assessment that has been used in Sarah case. Sarah journey highlight the importance of understanding both vulnerability and the protective factor, presenting issues such as depression and social phobia, driven by her history of trauma, domestic family violence, sexual abuse, strengths such as her participation in cultural activities and positive relationship, particularly with her stepfather, served as a protective factor. Risks such as social isolation, limited access to the resources, especially in the living in the regional and the remote area, and unresolved trauma increase our vulnerability to further mental health challenges. This insight informed the creation of a care plan tailored to Sarah's unique circumstances. Support system played a pivotal role in Sarah's recovery. Her stepfather and community leader provided stability and emotional support. Progress were measured using both quantitative tools and the qualitative feedback, including K10, Oasis, Quiz, and the feedback form that the Sarah has used after the session. And this all family history and all these factors are essential in mental health assessment, as family history is crucial and it can bring us significant risk factors for various disorders. For example, if a person dad has a BPD or died by suicide, then that can exacerbate and the mental health challenges faced by Sarah. So we determine all these factors into the care plan. So I just said care plan, and what does that mean? A mental health care plan is a structured document outlining goals, strategies, and intervention to guide recovery process. It prioritizes the individual strength while addressing risk factor and the challenges the person is facing. In Sarah Care Plan that was built on biopsychosocial model, integrating biological, psychological, and social factors to create a comprehensive framework for the treatment and, and the prognosis. Empowerment, self-determination, and the collaboration were central to this plan when I crafted her plan. As you can see on the videos, the care plan included therapeutic interventions such as narrative therapy and the brief intervention in youth mental health toolkit models. Goals are using the SMART criteria, which is specific, measurable, achievable, realistic, and time bound. And if this is not appropriate for us, it's the open door policy. She will be referred to other services within that community, such as telehealth psychiatrist, GP, and Aboriginal support services or vocational support services. And there is the monitoring and evaluation, which ensured the progress was tracked and adjustments were made to meet Sarah evolving needs. Like her plan, a person-centered care plan was essential to Sarah recovery, built on biopsychosocial model as it addressed her strength, challenge, and cultural context. Using motivational interviewing, we collaborated to set SMART goals and empower her involvement, referral to GP, telehealth psych within the headspace, and Aboriginal support services was complemented in her care. In the care plan, it was necessary to formulate the case using 5 Ps: predisposing factors, precipitating factor, perpetuating factors, protective factors, and presenting issue. Predisposing factors are the factors that had happened before. Precipitating factor are the recent stresses. Perpetuating factors is um, such as the withdrawal sleep cycle as a result of what's been happening now. Presenting is problem with the presenting issue. Protective factors are the strength of the client. Working with Sarah reinforced the importance of cultural sensitivity and the trauma-informed care. This experience highlighted the value of evidence-based practice, the role of self-care for practitioners, and the need of continuous reflection to improve the service delivery. Sarah's journey underscored the complexity of mental health care and critical need for culturally competent, holistic approach. That's why we use the evidence-based practice and recognize the significance of cultural identity, and we support individual like Sarah to achieve and foster the positive environment in her recovery phase and the overall well-being. These all are the differences, guys. Thank you.